Well, a manufacturing facility in Richmond is attracting national attention for a pilot program that helps Hoosiers battle the opioid epidemic with the promise of employment. Belden makes high-end broadcast, industrial, and network cables at the plant, but employee recruitment began to suffer as the opioid epidemic swept throughout the state. Kylie Veleta explains in the Business of Health. Kylie.
Thank you, Gary. Belden says throughout the last 2 years, the number of applicants failing drug screen tests has nearly tripled. The alarming trend helps spark its Pathways to Employment program. Applicants who fail pre-employment drug screens are offered a personalized rehabilitation program and a job at Belden if they successfully complete treatment. Here to tell us more about the program is Leah Tate, Belden Vice President of Human Resources. Thank you for being here.
Thanks for having me.
One thing we hear a lot about the opioid epidemic in Indiana is that it impacts rural areas. Sometimes those are the hardest hit. So why did Belden really want to take matters into its own hands and create this program?
Sure. So over the last couple of years, we saw almost tripling of our failed drug screens. We've all seen the statistics around opioids, and Wayne County is amongst the highest in the state. The Richmond community is extremely important to us. We've been in the community almost 100 years. We have an aging workforce, and we know that we're going to have retirements upcoming. So in an effort to be proactive around our sourcing of manufacturing talent, we decided to create a program to help people deal with addiction. So to address the issue and put people back to work.
And you started Pathways to Employment earlier this year. 23 people have entered the program. What kind of results are you seeing?
Yeah, so of the 23 that have entered the program, we've had 9 that have successfully gone through a portion of their recommended treatment. They've gone through and completed the required amount of clean screens in order to graduate into operating machinery. We have another 5 that are still in safety-conscious jobs, but we're hopeful that very soon they'll begin operating machinery. We have 2 that are now in the assessment process, and we do have 7 that have unfortunately dropped out of the program.
You're getting a lot of national attention for this program. Second Lady PENCE visited your facility last month. A lot of critics say businesses should be getting more involved in the opioid epidemic and substance abuse in general. So do you hope this can be a model for other companies?
We do hope it can be a model. We believe that in order for us to really address the addiction issues, that we have to work together with corporations, state and federal governments in order to address the problem. And we feel like we're happy to share the program we've put together. We feel like it's a model that other companies can take and tweak them and make it fit for them.
And we were talking before, you know, these applicants, they have the skill set, they have the education, they're just failing the drug screen. So do you feel like this really gives people hope? What are you hearing?
We do feel like it gives them hope. It's been really rewarding and exciting to hear the reaction of people that have gone through the program, to hear their stories and see how this second chance opportunity has impacted them.
And it's not just opioids, and you're seeing that in the drug screens.
We are. We started the program around an opioid discussion, but as we've gone through, we've seen people fail for a host of different substances, many times a cocktail of substances. And so we've not limited it to opioids, but that's how the program did begin.
And just a few seconds left. What do you see for the future of the program?
So we'd like to continue to share the program across the state with other employers, and we're looking at, within Belden, opportunity to expand to other operations across the country.
Well, it's a great example of businesses really getting involved in an important health issue. Thank you for being here.
Thank you for having me.